Good morning, class, and welcome back to week 4. This week we're going to review chapter 37, which is imaging, nuclear medicine, and radiation therapy sections. In this chapter, we're going to explore three essential areas in medical coding, and that's the imaging, the nuke med, and radiation therapy. These sections are foundational to understand how the diagnostic and therapeutic procedures are reported using ICD-10-PCS coding system. Imaging allows healthcare professionals to visualize the insides of the body, supporting accurate diagnosis and treatment planning. Nuclear medicine techniques go beyond imaging, enabling assessments of metabolic functions for both diagnostic and therapeutic purposes. Radiation therapy provides powerful options for treating malignancies using advanced technologies to target diseases while protecting healthy tissues. Throughout this chapter, I'm going to break down the coding structure for each section and highlight key terms and discuss practical examples. Um, Again, I work hard at making the lecture as exciting as it can possibly be. I know it's a lot of material and sometimes it can be a little dry. So I really do try to make it a little bit more enlightening and kind of highlight what's important based on my experience and what I've seen out in the field for the past 22 years and then some. So, before we dive in the details, let's take a moment to think about what you're going to be able to do and recognize by the end of this chapter. So, by the end of this chapter, you should be able to recognize exactly what details are required from the imaging section. Imagine being able to look at the procedure and know right away what needs to be documented. And, it may not happen immediately. It's going to, again, you've heard me say this over and over and over that practice, 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 and give yourself grace to understand, wrap your arms around this new language and make it your own. So, when you think or when you see a nuclear medicine procedure, do you feel confident picking the right code? We're going to work together to evaluate the details and make sure you can always select the right code from nuclear medicine section. Here's another challenge. Radiation therapy codes can seem complicated. Do you know what specifics you need to build a complete code? We're going to review that. And pulling it all together, by the end of the chapter, you'll be able to analyze all the details and build a precise 7-character code for sections B, C, and D. Let's see, did I skip a slide here? No? Okay, sorry about that. Um, there, as with every chapter that we go through, there are those key terms, and there are just 4 key terms for this week. The first one is densitometry. Densitometry is a technique that is used in a clinical setting. We're going to talk more about that. There's also high osmolar, which is a type of contrast media. It's often called ionic contrast. Intravascular optical coherence is a technique that helps visualize blood vessels from the inside. And then we have low osmolar, and that's a non-ionic contrast media. So it's important to understand the differences because when you assign the PCS code, you have to assign it appropriately. You don't want to sign an osmolar code when it's actually a non-osmolar contrast. Okay. My computer is just really acting weird this morning. Um, Not only that, I can't get my camera to work. Ugh. Did an update and it's like just being really annoying. Okay, I apologize, folks. Bear with me here. All right, so we got the key terms. So let's jump into our first major topic, the imaging section. So let me ask you, when you hear imaging, what do you think about? Do you think of X-rays, or maybe you think of that CT scan that you had when you went to the ER with right upper quadrant abdominal pain, and they were ruling out, um, cholecystitis or gallstones. Now, imaging is about using technology to see inside our body, and it's a critical part of both diagnosis and treatment planning. In this section, we'll focus on how to accurately report imaging procedures using our PCS system. So, just to think about this, have you ever looked at a chart or even if you've gotten a copy of your radiology report? And, have you ever thought, what details do I need to code this imaging procedure correctly? How do I go about doing that? If I were gonna, if, I challenge you to, if you have had to have imaging studies, if you've gotten copies of your records, um, have you looked at it from the perspective of, how would I go about coding this if I had to code this? It's a good place to start, and it's really kind of an eye opener when you start applying it to what you know. That's so personal, whether it's your own body or your child's body or, spouse, and looking at the details. It's pretty eye-opening. So let's jump into the imaging character position. There are 7 character positions you need to pay attention to. So the first part, of course, is what section of the PCS book are we working in? Um, which part of the body system is being imaged? Is it the abdominal? Is it an extremity? Is it your brain? What is it? Um, what is the root type? So what you want to ask yourself, what kind of imaging is being performed? Is it an MRI? Is it a CT, a DEXA scan, X-ray? Body part. Now this gets into specifics. What is a specific anatomical site? Can you pinpoint that exact precise location? We may be looking at the body system of the abdominopelvic, but do we have a specific site that we're pinpointing? Was contrast used? If so, what type? Are there any additional details that need to be specified with the qualifier? And yeah, there can be a second qualifier. Um, so, when you think about it, why do you think it's important to be specific with these details? Think about how might, if you don't have that specificity, what happens? And this is nothing new. This isn't a question that you've, heard before or been asked to um, think about before. So this is something that, I prompt you and I encourage you to continue to think about. So here's a coding bite or bit for you. This is a practical tip that can make a big difference when you're working with imaging codes. So I have a question for you. When you're coding an imaging procedure, do you know how, or do you, if you think about when you code it, or you learn how to code, do you know how to distinguish between the upper and lower body parts of the body? Lower, upper and lower parts of the body. The dividing line is in the diaphragm. Everything above the diaphragm is considered upper and everything below is lower. Why do you think this distinction matters in coding? Can you think of a scenario where getting this wrong could impact the code? Now let's talk about the axial skeleton. The axial skeleton is the torso, the central part of the body. The appendicular skeleton includes the extremities, arms, and legs. How might knowing the difference between axial and appendicular help you choose the right code? Some things to think about. So there are several different types of imaging procedures that you'll encounter in coding. We have plain radiography, which is X-rays. Um, who's seen an X-ray before? I think probably everybody who is a human being has had an X-ray, right? What kinds of conditions are usually diagnosed with this technique? Fluoroscopy. This is like a real-time X-ray. A CT, which is a computerized tomography, CT scan, is like that donut. When you have the scan, it's like you're going into a donut. It's a quick scan. Um, and a lot of times you're given contrast, which gives you that feeling of having to urinate. It's a very bizarre experience, but it's a quick scan and it's more for looking at soft tissues, obstructions, things like that. They often use a CT scan for your head and for your abdominal pelvic region, specifically in an ER setting. Um, the MRI, magnetic resonance imaging, uses magnets and radio waves. And that's that really, if you've never had an MRI, you basically you go into a very tiny opening, um, the body part that's being scanned, and the magnets circle around you in this big shell. And so these magnets go thousands of miles a second. I mean, they're just going really super fast, spinning around you, and it's very loud. It almost sounds like to me when I've had it done, it sounds like a horse clop, 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 clop. Um, and then they also often give you gadolinium contrast to help highlight the body part that they're trying to look for, or that they're looking at rather, and trying to diagnose. That's often used with backs, like you have MRIs done on the backs or bones, sometimes solid structures, like if they're looking for a tumor, anything of that nature. The ultrasonography is used in obstetrics, but it's also used what other situations? Um, I can think about soft tissue, Doppler um, ultrasound, to check the extremities, to check the blood flow in your extremities. Um, how does knowing this root type help you choose the right code? Have you ever had to decide between coding for an MRI or a CT scan? Something to think about. Oh gosh, come on. My computer. Okay, types of contrast. We have high osmolar, which is known as ionic contrast media. And some of the examples that you'll see for high osmolar are diatro diatrozoite, metrozoite, and iothamite. And, honestly, that's not one that I've come across a lot in my radiology coding days. Um, and you're not going to code that type of contrast unless you're coding HCPCS, honestly. But let me put it this way. If you are coding PCS, you do have to understand the ionic contrast medias and the organic or non-organic or ionic contrast media. So these are important to understand how this field impacts the high osmolar or the low osmolar contrast. Now let's shift gears and talk about nuclear medicine. When you hear nuclear medicine, what comes to mind? Maybe a PET scan or those special tests where a patient swallows or is injected with a tiny amount of radioactive material. Nuclear medicine is unique because it doesn't just show us what things look like, it can show us how organs and tissues are functioning. Why do you think that's important? Can you think of a situation where knowing how something works inside the body is more valuable than just seeing its structure? In this section, we'll focus on how to report nuclear medicine procedures accurately, using the ICD-10-PCS codes. So, when you see a nuclear medicine procedure, do you know what details you need to capture for accurate coding? Well, the first thing I should hear from you is yes, there are 7 characters. Remember, because there's always 7 characters with PCS. That is the theme. That is the trail that um, that code, if you will, that we're filling in. We're looking at what section of the PCS are we in? What body system is being studied? What root type? What kind of nuclear medicine procedure is it? What body part? What is the pinpoint, the exact anatomical site? So you're focusing on the granularity of detail here with that body part. The radionuclide. Um, what radioactive substance is being used, if any? Qualifier. Are there any special circumstances or details? And then a qualifier number 2. Again, sometimes there's a second qualifier in this section. So let's go into some different types of nuclear medicine procedures that you might see, you might come across. Planar nuclear medicine imaging is a classic nuclear medicine scan. Tomographic or tomo nuclear medicine imaging is a cross-sectional imaging scan. So it does slices of images and it puts them all together. Positron emission tomographic or a PET scan. PET scans are good for looking at metabolic activity. Non-imaging nuclear medicine, sometimes it's not about the imaging but about measuring how much of a substance is being taken up in an organ. Then we have non-imaging nuclear medicine probe. This involves using a probe to detect radioactivity in a specific area. Let's take another coding bite. Um, so this is a practical tip for you. Um, and something to think about if you see a case where there's more than one pharmaceutical used during a single patient encounter. It happens. It happens a lot more than you think, especially in inpatient settings with complex diagnostic or therapeutic procedures. Here's your key takeaway. If the documentation shows that more than one pharmaceutical is used during one encounter, you need to report a separate code for each identified substance. Why do you think it's important to code each radiopharmaceutical separately? How might missing ones impact the patient's record or billing? This is a detail that's often easy to overlook, but it makes a big difference in coding accuracy and compliance. Don't forget about coding compliance. So, when you are going through um, a chart that may have a radio pharmaceutical used, you want to do a thorough documentation review. Always start by carefully reviewing the entire medical record or the entire episode. When we say review the entire medical record, you're not going through every single visit. You're only reviewing that one episode, that one visit. Because remember, we learned this in ICD-10 that a encounter has to stand on its own. As a coder, we can't go back to other encounters, other dates of service, and see, oh, hey, what was done, and have that influence what we're doing today. That's really, really important. That's like a big rule in coding. Always make sure that that documentation stands on its own for that date of service only, not for another date of service. That wouldn't hold up in a court of law. You have to make sure it's for that date of service. So Secondly, you want to clarify ambiguous information. If the documentation is unclear or missing the key details, like a specific radionuclide or procedure type, you want to query or ask when you're a new coder, ask your manager um, what they think about it, and what the process would be to query. Tracking multiple procedures and substances when there's more than one radiopharmaceutical utilized, each must be coded separately. And then, always stay current with those coding guidelines. Coding guidelines change yearly. Sometimes they can change quarterly. So it's really important to stay up to date with your coding rules and regulations. Let's move on to our third major area, radiation therapy. When you hear radiation therapy, what comes to mind? Maybe cancer treatments or those machines that deliver focused beams of energy. Radiation therapy is a powerful tool for treating malignancies, and just like imaging and nuclear medicine, it has its own unique coding requirements. So in the next few slides, we're going to focus on how to accurately report radiation therapy procedures using the ICD-10-PCS system. When you're coding a radiation therapy procedure, do you know what each character in the ICD-10-PCS code stands for? Um, so again, we're looking at the section of the body system, which is the section of the PCS book. What section are we working on? Then we're looking at the body system, number two. What part of the body is being treated? Number three, root type, modality. What kind of radiation therapy is being used? Number four, we have the treatment site. Can you identify the exact location being treated? So we're getting into the granularity of detail here. We're using that magnifying glass to focus in on what area is being treated. And then we have number five, modality qualifier. Are there any special details about this modality? Six, we have isotope. Which radioactive isotope is used? Seven, we have qualifier. Is there any additional information to specify? And this slide talks about types of radiation therapy. So with beam radiation therapy or EBT, this uses one or more beams of high energy X-rays directed at a patient's tumor. Brachytherapy is using radioactive seeds placed in or near a tumor. They deliver a high dose of radiation directed to the tumor, helping to protect surrounding healthy tissues. And this is often used with prostate cancers. Brachytherapy is used, and um, it's very, very specific just to that area. So, and it's ongoing. Um, Next, we have stereotactic radiosurgery, and this often refers to CyberKnife. And CyberKnife is a high-powered energy on a small area of the body. There are no incisions involved. It's just all through proton beams and highly focused, highly specific mapping that is included. Um, so again, very important to understand the differences between the types of radiation therapy. And this is just a high-level overview. Once you really, if this is part of your focus and coding, if you have to code a lot of these, you're going to see a lot of variations and you'll learn more about it. Here are some side-by-side comparisons of the differences between EBT versus SRS, the treatment approach, the number of sessions, precision, target size, equipment, etc. So I just snuck in that little side-by-side comparison for you. So we're going to wrap up chapter 37, by highlighting the most important points to remember. Imaging is a powerful tool that allows physicians to see inside the body, supporting accurate diagnosis and treatment planning. Nuclear medicine goes just beyond imaging. It enables us to assess metabolic functions and can be used for both diagnosis and therapy. Radiation therapy offers an effective way to treat malignancies using advanced technology to target diseases while minimizing harm to healthy tissue. Some key things to remember, always review documentation thoroughly for that data service for all required details. So we're talking about procedure type, site, substances, etc. Stay current with coding guidelines and updates. And it may be helpful to use a checklist or coding tool or tip sheet to ensure you capture every procedure and substance. Uh, Specifically important when multiple um, you know things, multiple modalities are used in a single encounter. You also want to work with clinical staff to clarify procedures and help improve documentation. So that concludes our chapter. It was short, sweet, and to the point. I apologize for some of the technical difficulties experienced here. Hopefully, we can get that smoothed out for next week. Until then, please reach out with any questions that you might have. I'm here for you. You can post on Canvas. You can also send me an email. Remember, my office hours are Wednesdays from 4 to 5. Um, and reach out. I hope you have a good week, folks. Stay safe out there.